Our final presenter tonight is Johnwilliam Carroll. He is going to present on social determinants of health project that he was working on in DC, including interlinkages with COVID-19.
All right. Well, I'm Johnwilliam Carroll, graduate of University of Oklahoma and George Washington University. I have a background in environmental sciences and later geography. And during the pandemic, I decided to take a bit of a look at the coronavirus data from DC and decided to visualize the data more so in GIS, and additionally, trying to understand what could be behind the trends I'm seeing. So I collected data from when the first case had started in March 8th of 2020. The first case was reported in Washington, D.C. And I waited a year before cutting off the data in March 15th, 2021. And so far from the data, it showed that wards 4 and one neighborhood in Ward 1, but primarily Ward 4 had the highest amount of cases. But interesting enough, Ward 4 did not have the highest amount of deaths. That total belonged to Ward 8, 5, and 7, respectively. I was curious to wonder why is that despite having the highest amount of cases in Ward 4, they only had the fourth highest amount of deaths. And just before continuing, I want to say that last time I checked the data on May 3rd, Ward 5 now has the highest amount of deaths in Washington, D.C. But the death placement has not changed, with Ward 8, 5, and 7 having the highest amount of deaths. So just a brief update. The placement has changed. Ward 5 has the highest amount of deaths. Wards 8 or 8 would be in second place, and Ward 4 would be in third place. So I started to look into the social determinants of health, which are a combination of social and economic factors that can reflect the differences between populations. And some of these factors are not limited to education, health and healthcare, social community context, income, economic sustainability, and the neighborhoods of where one lives in. And it's kind of variable. I've seen different sources about how much each one plays a context, but I would say each one has their own play into describing the social health of a given community. So before going through some of the maps I made, I just want to kind of do a brief refresher of each ward map in DC. So here's the map that shows wards 1 through 8 in Washington, DC. Kind of goes in a semi-clockwise position from Ward 1 around to Ward 8. Actually, semi-counterclockwise. And some of the data I've collected, I collected from DC Open Data, which is the Open DC GIS source resources. I also collected from DC Health Matters, which is funded by, I believe, National Institute of Health, and as well as taking some of the data and putting it into the latest version of ArcGIS, which I believe is 10.8.2. One of the data shown here is a metric called food accessibility. Here, for DC Open Data, they combined the neighborhood's income level compared to the poverty line and the distance to the nearest grocery store. If hopefully it's big enough to see it, but I decided to create a map showing the grocery store locations, which mapped in perfectly with the neighborhood income lines, and it shows that that neighborhoods more so in the red are predictably wards 8, 5, and 7, more so on the eastern side of the city. Another one is involving adult daily fruit consumption, at least eating 2 servings of fruit per day. And an interesting detour, wards 8 Ward 8 and 5 were the highest amount, and wards 4 and 1 was actually in the middle of the pack. Ward 7 actually had higher food consumption. Current asthma still followed the current trend. Wards 5, 7, and 8 had the highest percentage of adults with current asthma by DC Health Matters in 2017. Regular physical activity was also one of the metrics where wards 5, 7, and 8 were the highest, were actually the lowest amount of those who actually engage in regular physical activity, be it exercise or physical strenuous work. There are other maps that I could include it, but in the briefness of time, I needed to shorten it. But those were a few other maps that kind of showed exactly the trend that was showing behaviors in health as well as economic placings that kind of defined exactly how deaths kind of shows at least a relation between the deaths of COVID. And when I look at the data, it kind of showed more so. There was some data that actually couldn't put on the maps because there were limitations. DC didn't have war-specific data for factors like obesity, smoking, which is another respiratory factor, as well as education. The data I found was pretty scarce and was pretty old. Also found was other factors didn't matter as much. I did have a map for access to primary care providers, such as hospitals and primary care facilities, and found that there was a bigger concentration of them in wards 8 and 7, and not as much for the wards that had the lowest death amounts in wards 2 and 3. So it was interesting looking through the data, but more so it's followed a similar trend of wards 5, 7, and 8. And I keep mentioning 5, 7, and 8. It's also where the highest percentage of Black residents are. And with those high percentage of Black residents, this was taken from earlier article in Politico when looking into early vaccination data, and found that those wards that had the highest amount of Black population registered the highest amount of deaths. Last time I checked, at least 90% of the deaths related to COVID in Washington, D.C. are of Black Americans. And through the research, I realized that more so the biggest drivers of death, at least in related to COVID-19, was not about getting the case, but about the socioeconomic conditions of where one lives in. But I want to thank everyone who helped me assist me with the project. All my friends who in GIS and my geographic advisors.
Well, thank you very much, John William. Does anybody have any questions for him? So I have a question, and this is something that is difficult for me to ask, as my day job is with a statistics agency. We observe, we don't say why necessarily or what can be done. But do you have any thoughts of how these particular disparities could be addressed?
In a way, how could it be addressed? I do believe is addressing not only more resources, such as probably more accessible locations for fruits, for fresh produce in stores, but additionally encouraging healthy behaviors as well. But that also comes with having an environment that encourages healthy behavior. Sometimes in those areas, I think I used to live in Ward 8 off and on when I was a kid with my father. It was not really much a place I can actually go out to play in when I was there. So there's, I think, a multi-prong approach. One is having stores or grocery produce areas that provide subsidized produce or subsidized food, encouraging healthier lifestyles, but also having an environment that encourage outdoor activity. I think that's another way to help. I noticed the areas the wards that do have the lowest amount of deaths have a lot of those factors. They and on top of that, well, there's also income, but that's all dependent on exactly type of jobs one gets, and that's really something that's unfortunately we can't control. Yes, Matthew?
Yeah. So I have another question. Is there any way of sort of parsing out sort of race and socioeconomic class? Because there's certainly a lot of middle class African Americans in DC, and it might be interesting to see if they fared more like white middle class people or somewhere between sort of people from a challenging environment. And just kind of related, there was some thought about sort of vitamin D deficiency having some effect with COVID, and just if you have darker skin in the winter, you're going to have more deficiencies, and that might have been not the major factor because obesity and other factors, but that might have been a factor too. Thank you.
Right. So start with the first one. I actually was looking at income data early on, and DC Health Matters actually did provide income data of per race for each ward. Wards 4 actually did have the highest amount, had one of the highest incomes that had the highest share of African Americans. So it did matter exactly what class you're in, because at least what class you're in or how much income you make definitely impacts the access you have to food, access you have to certain services or illnesses if you have or pre-existing conditions. I'd also exclude a map of pre-diabetes. But those with higher income, those could be addressed more. And when I did look at the other wards, like 5, 7, and 8, they were on the lower end. I could try to go back to the map. It also excluded a median income map, but the neighborhoods that had the lowest median income and that as it had the highest amount of black shared residents were the ones that had the highest amount of deaths. So you could say there's a bit of a correlation. And for those African Americans who lived in wealthier wards and higher incomes, they were more likely to survive the pandemic.
May I?
Sure.
Yeah, no, I'm curious as to how you came to pick DC, at least from the point of view that DC was only reporting out COVID data by wards, which is a pretty big unit of, which are pretty big areas that are pretty heterogeneous. While Virginia for sure, and I think Maryland were reporting out COVID data by zip code, which not only are smaller areas, but you could also then look up socioeconomic data off of census to be able to drill down on things like what kind of jobs people had and how many poor people lived in the zip code, which is just a different figure than median income. Why DC?
Funny enough, I am born and raised here.
Oh, okay. I mean, I looked at theirs, but it's like they just weren't handing out data I could do much with.
Right. And that's the limitations I had too. Some data actually did have for wards, but then they were incomplete, and I kind of felt that would be disingenuous to include those into the overall analysis. So it is a bit spotty.
Okay.
And wards,
Well,
I mean, it's kind of simple. Like there was dividing lines, and like the highest they did show highest amount of cases by neighborhoods, which was along the 16th Street corridor and Columbia Heights. And that was between wards 4 and 1.
okay. Well, for what it's worth, if you want to take a shot at it, you should know the CDC publishes something called the Social Vulnerability Index, which has 15 American Community Survey social determinants indicators broken down by census tract. So with a little bit of aerial function programming, you might be able to build those up for wards. You can just go to the CDC's down set and download it. It's like there's an ESRI shapefile for the whole country that's only about 260 megabytes. It's also available for individual states, including DC. I found it to be a nice data set to use if you're interested in social determinants of health.
Sure. Let me make sure I remember to write that down, or if you don't mind sending it to me in the chat.
Okay, yeah.
Please, thank you.
Sure.
Also see, I think, another question in the chat. Okay, yep. Sure, I'll get it to you. And
Yeah, there was a question in the chat if we can get a link to the full study and the data. There was a comment that it would be interesting to see public health spending or city budget expenditure per ward. And there was another comment of DC also sometimes shared neighborhood COVID data, but uncertain how rich it was.
right. I think initially for analysis, I just use what the city had provided. It's kind of interesting to go through and see if there's any smaller, more neighborhood type of data, because DC did have that. They did have neighborhood. They still do have neighborhood data. But it'll be interesting to see if there's like recordings outside of the city government doing it. As for the per ward as public health spending and city expenditure, that would be interesting to see. I think maybe one thing I forgot was how much locations of DC vaccination sites and other things that had to address COVID related. I think there were a good amount of them were in Ward 7 and 8. That's something I probably should have paid a bit more attention to check on a city.
And then Lloyd had pasted the link to that CDC data set he referenced as well in the chat.
Yep, thank you.
Okay, any final questions for Johnwilliam?
I do. I would be curious if you just have a more broad question of, as this data is just more and more available, and I know you had some struggles in how you access some of this data, how could it be used? Like what kind of actionable decisions or what kinds of things could be done, do you think? And I think you mentioned some of it, how it could help drive, maybe more where we put more healthy foods, or maybe, different things like that. But how could it be used maybe while we're dealing with this crisis now or long term?
And sure, long term, you can definitely tell where, if there was a viral disease, what factors, like which areas would be the most vulnerable or more likely to have more resources devoted to it. And the reason why I looked at it, because the reason why I wanted to make sure it wasn't COVID, COVID wasn't a disease where if you got it immediately, you might die from it, is because more so it was not an efficient killer. So when I looked at it, I thought, okay, if a flu came in, a similar respiratory disease, and came through the city, who is more likely to be most affected by it? Who's more likely to be more hospitalized by it? Who may need more of those resources because they cannot buy or have those things on their own? But even outside of the pandemic, you could look at those areas and think, okay, who needs to have, which regions need more food markets? Because I think, well, not just food markets, but anyway, you could provide accessible produce and maybe make areas that would be more accessible or encourage more outdoor indoor exercise activity. Because living in Ward 4 and sometimes going between wards 1, 2, I noticed that there's an opening for a new grocery store there in a place that really doesn't need it. We do not need another Wawa. We don't need another Trader Joe's. It's nice. It's nice to have a couple of Walmarts, but it's also harder when there's other people and other wards that have to do more to even get to those stores, having to cross the river. And it's also hard for businesses too, because they have to, because where they plant their store, they're hoping the income of the area is enough to support them. I don't know the exact amount, but I think at least twice the income of the area has to be at least twice the amount for the budget. But I think the income has to be a lot to support a store, and so that's why it's harder. That's why there's less stores, and that's was a better correlation than access to a health center, because there's enough health centers there for if anyone need care, and hospitals. But preventive measures probably one of the best ways to alleviate and prepare for the next usual viral disease.
All right, well, thank you very much, John William. Really interesting presentation, really important topic. So I'm glad you were able to join us tonight.
Thank you.